What has the COVID situation been like in Baton Rouge?
But I'd first start with it was unique. Unique in the fact that it wasn't like other natural disasters that our team has dealt with, whether it be a flood, whether it be a hurricane, where there's kind of a prep phase and then there's definitely an ending point where it's kind of over and we're just kind of recovering. This pandemic was completely different. There was no playbook out there to say, hey, this is what you do when. And so our team kind of learned as we went and did a great job pivoting and where we needed to and always putting the patients first. And I would say that I was not surprised by the response because this is a very resilient team here. They did a great job. They've been through the floods of 2016. We've been through Katrina and Gustav and all those things, and they just rose to the occasion. So I can't say enough about our team's response to COVID-19. I will say now we're kind of in the phase of revamping and ramping back up. And now it's kind of like the new normal. So how do we operate knowing that we'll have COVID-19 with us for a very long time? So that's really what we've been focused on, preparing our clinics with cleanliness and all the things that we need to do to ensure the safety of our patients and obviously our staff. But so now it's kind of operating in the new normal. So that's what we've been working on.
I'm curious to know why you think Ochsner is such an important presence in Baton Rouge, in that region.
Yeah, well, I think I'll first start with our health rankings in the state. So I would tell you that I am certainly not happy, and none of you should be happy with the rankings that we are, because most of the time we're either 48th, 49th, 50th in the country in our health rankings, which is not acceptable. It's not acceptable to me, and it shouldn't be to you. So at Ochsner, we're always looking at how to provide patient-centric, innovative care to our patients. So we want to be disruptive, but in a good way, right? We want to do things differently because obviously what we've done in the past has gotten us the results we have today. So we have to do things differently. So whether it's our digital medicine program, so things like we have a program called digital hypertension. So we can monitor patients remotely with a device that they have from home that connects to their phone. We have a team of doctors and pharmacists and health coaches that communicate with patients, and we've seen huge success with that. We've seen anywhere from getting their target blood pressure within 90 days to upwards of 70 and 80% of the time we can do that versus normal care, which is around 30%. And so things like that we do. We have programs in digital diabetes. We have one for pregnant moms. We have other ones that we're rolling out. And we have a platform called YOchsner that you can get access to all those things and book appointments 24/7 and look at your labs, your x-rays, communicate with your provider. Our goal is to give tools to people to be able to manage their health better. And so that's what we've been focused on. We want to do it in a patient-centric way. I can't think of another example other than our new Grove facility that we built off the interstate there at I-10 and Siegen, right next to the mall. If you walk in that building, you notice right away that things are different. For one, there's no registration desks there because we know that from past experience that when you put a registration desk right in the front of a clinic, what happens? People stack up, they stand in line, they're trying to register. So we actually have kiosk registrations to make it really fast for you to register. We also have our O-bar right next to when you walk in. We have someone there that shows you all the technology, just like the Apple Genius Bar. We have someone there to show you all the technology we have to help you manage your health. We put like services together. So a lot of folks that go to orthopedics and neuro and those type services need to have imaging. So guess what? We put imaging right next to those services and put them all together and actually put physical therapy with them as well to make it easy on our patients. So those are the things that we can offer in this community, and we're happy to do that. And it's all because we're part of this big system. So that's a big advantage for us. We're part of the largest system in the state. If you didn't know that, it's Ochsner Health System, largest in the state. We have a hospital in Mississippi as well. But they offer us a lot of resources that we can bring in all the communities that we operate in. So it's a big advantage, and we're happy to be part of such a large system that we can improve the health of our communities that we serve. And so with that, thank you.
Yeah.
A good example of an advantage of being part of a system was this COVID-19 response. And so as you may recall, when we first started testing, we were using a lot of outside labs that were taking up to 2 weeks to get your results. And obviously that wasn't a good thing when we were trying to identify who had it so it didn't spread. So Ochsner quickly pivoted and they said, you know what, we can get the technology, we have the people, we can bring this in-house and do it much quicker. So we were the first ones to bring in the test in-house. We had turnaround times between 24 and 48 hours when it was taking others up to 2 weeks. We were the first to offer the 15-minute rapid test. And so, we had a great pipeline of PPE to protect our employees. And so that is really an advantage being part of a big system. So again, we're really proud to be part of it. And thank you very much.
Yeah, absolutely. Absolutely. And that's what I've heard over and over again is how well resourced Ochsner employees have continued to feel despite sort of the national commentary that has sometimes been not the same at all facilities. So I've personally been really proud of that, really relieved by that. I'm really excited about some of those things you mentioned, the innovation, especially at our High Grove campus, of course, but the innovation that we're able to share resources across regions and across facilities. Definitely the right resources we need to be able to face and fight a pandemic like this. So thank you for those thoughts, Eric. How has COVID changed things, there and the hospital, right? In the boots of the ground of the facility?
Actually, that's a very big question. Actually, I think every one of us on this Zoom call could talk about how things have changed for go on and on. But for one big thing was the environment changed. It was different because outside in the parking lot there were fewer cars, but inside there were more people. And there were more people focused on the patients that needed COVID care, but there were patients in the hospital that needed more than COVID care. And so we were taking care of those patients as well. So we focused on repurposing our people, repurposing our space to make sure that we maximize all the resources that we had across the entire region. We had physicians come in and support our hospital physicians. We had nurses from our clinics come in and support our hospital nurses. We had non-clinical staff from across the region come in and support our hospital teams during this time of immense volume. And so the environment changed, the people changed, and people were able to expand their scopes. They learned new things. They contributed in a way that brought value to them personally as well as to their families. As an organization, we committed to making sure that we kept all of our employees employed during all of this. And we asked them to do a little bit of different work, but they all got some enjoyment and some appreciation out of it, and we were able to achieve that as well.
Wow. Yeah, that's amazing. That ability to keep staff employed is such an important feat that I'm really proud to know that Ochsner was able to accomplish. And it's so critical to every region that we serve. With more than 40 hospitals that we either own, affiliated with, or manage, that is, we have a really broad reach, and it's been really impressive to see, leaders such as yourself to be able to help us maintain this employment for all of this staff. It's truly such a positive experience given what we're all dealing with. And as someone who doesn't live in Baton Rouge, I'm a little curious to know what's really unique about the Baton Rouge campus. What makes it, its own, stand out on its own, Scott?
Another great question. So there's a little bit of uniqueness about all of our campuses. I think what is great about Ochsner is we've got the consistency and the support of a very large system. Yet we've got uniqueness in all of our locations. I mean, we've got our 2 hospital campuses, one on I-12, one on I-10. We've got a dozen community health centers and more in development across the entire region. And each one of those has a little bit of its own family feel to it. The team on this call right now has a new hire lunch with all of our new employees every couple of weeks. And one thing we ask is, what attracted you or what stood out to you about Ochsner when you made the decision to join this team? And time again, in every lunch meeting, at least a few people will say, it just felt differently. It felt like family. You walk in the building, you immediately see people smiling, conversing with each other, engaging us as newcomers, as new hires, not even knowing that we were potential new hires. It feels different, and it feels so much like family wherever you go in the Ochsner network.
Yeah, I think that that's true. I've heard that. I've just heard that multiple times. I did used to live in Baton Rouge, so I've had a little experience with the Ochsner Baton Rouge campus. And it's great to know that that family's growing with the addition of the High Grove facility. Really bringing additional resources to that region is so important. And you mentioned just that family feel and that people feel it feels different here. I'm sure that has continued to be the case during COVID-19 because you guys were so close knit. Teamwork is such an important part of being able to respond in a crisis. And I think maybe Stephanie would be a great person to answer my next question. How have you seen teams really work together and help each other in the Baton Rouge region while we have been fighting COVID-19?
Yes, I think that's probably the thing that stood out to me the most was around the teamwork. In nursing, you can't do your job without your team, but there's still silos within the units, and this was an opportunity to break down a lot of those barriers. We were able to quickly kind of identify, based on the feedback from our New Orleans team, around ICU was going to get busy. And here in the Baton Rouge region, we have a 20-bed ICU. We were staffed for 10 beds. So it became an immediate concern, and we were able to say, who wants to volunteer? Who's here to help? And we had so many people raise their hand and say, I will go. We didn't have to make anybody go. We didn't have to force any of our team. It was just right off the bat. We had procedural area nurses who had ICU experience. We had nurses who had just left the ICU go back. And we were able to identify a couple of our RNs, LPNs, and MAs from the clinic who actually went through education and training to assist on different units. And they were redeployed to our ED and telemetry as well as ICU. So it was just amazing to see the teamwork. The first few weeks were really, really hard. A lot of people were shocked, honestly, at what was going on inside the hospital and outside the hospital. And on top of that, the mandatory stay at home was put in place. So people were worried. And we all just came together and said, what do you need? What can we do? How can we help?
Wow, that speaks volumes to that team. It really does. Being able to meet all of the needs of caring for our COVID patients, while also, caring for our non-COVID patients. Healthcare doesn't stop in the middle of a pandemic. And knowing that you were able to meet the needs of those COVID patients and more was without, having to require that movement into those critical units just through volunteer support. That really speaks volume to that teamwork. What a great testament to that Ochsner value.
We decided as an executive team to stand up our local command center on March 13th, D-Day, I guess, for the Baton Rouge area. And it was also amazing to see the teamwork from our leadership, from people who were like, I can do whatever you need me to do. We have a patient experience team who we weren't rounding on patients at that time because of the COVID. So they were not allowing visitors or people extra in the rooms. And so they came together and said, we will help man this temp station. We'll help put this together. We had HR representation. Our supply chain went above and beyond anything you could ever imagine. So it really was a team effort in the truest sense of the word. And I don't think any of us could have done it alone. There's not one person who could say, I did this or I did that. It was completely a team effort. Wow.
Yeah, that's amazing. You really, I think the public doesn't realize how many other people are involved, in being able to stand up a crisis response and in what it takes to support you guys as our clinical experts to be able to do your job well and serve patients. The supply chain that you mentioned, I served a few volunteer hours, supporting the supply chain team in our main campus on Jefferson Highway. And you're right. I mean, they all just, whatever those units needed, they're hustling up and down, doing what they need to do to get them all the supplies they need. Such a great example of of it being really a holistic effort. So thank you for sharing that. Now, Diane, you oversee the clinical operations and staffing from a really broad view. Can you share with us a little bit about how teams were able to prepare, given those early alerts we received from New Orleans campuses?
Sure. It's a really interesting story because even before we had the first cases in New Orleans, we had sort of an interesting weekend here in Baton Rouge back in January, where a patient called the emergency room and said that she had been diagnosed with coronavirus. I got a call from Stephanie and I called Eric and we started working through what that would look like. The emergency room team, of course, responded exactly as they were supposed to. They used all of their protective steps. They knew exactly what to do. And as it turned out, she did not have the coronavirus that's causing this pandemic, but it did give us sort of a unique opportunity to test our systems and our knowledge. And we were able to take that, use it sort of as a drill and begin planning our responses. And so when the first cases did begin in New Orleans, we were able to take that information that they were learning and really integrate that into our planning and our staffing in anticipation of what was going to come. And, to Stephanie's point, we started early trying to identify what's our plan for staffing, how will we expand, where are our talents and gifts here in the system that we can pull back in to help us take care of these really, really sick patients.
Wow, that's so, there are so many types of coronaviruses, right? So interesting that she came in assuming it was the novel coronavirus, but kind of what an interesting way to get your team kind of for what was to come and really put your policies through the fire, right? To see what was going to work.
Absolutely.
But the ED is just where a patient starts when they arrive. What about the ICU, where I know most of the biggest battles fought in COVID? What's been happening there?
Well, just such a shout out to that entire team, because that was the other thing that we knew was that the ICU population would grow quickly, that the patients would be really sick. Also anticipating how will we continue to care for patients who don't have coronavirus, and how will we make sure that we're able to do that. We did actually at some point end up expanding the ICU and adding a second location so that we could separate our COVID patients from our other patients, provide that care and make sure that they got the same level of care that they would normally receive. I would say the other piece that's been fascinating to me about the ICU is just when you start with a novel disease that no one's seen before, the learning curve is very steep. And how do we learn from other people in the state, in the country, in the world about what works, what doesn't work? And this team was so integrated from provider to nurse. There was, every time I rounded in there, they would gather up and tell me what they had learned, what was the next step. And now we're actively participating in multiple studies to identify the best treatments for patients battling this horrible illness. So just a huge shout out to the ICU team for not only what they've done, but what they continue to do today to enhance the care for these patients.
Wow, that's so interesting that you pointed out too, that we're involved in some studies, we're learning and we're making sure to write down what we're learning now so that we can inform our best practice, both for our system, but also I'm sure for other systems. Ochsner is such a leader in healthcare really in the nation, and our CEO Warner Thomas has been really supporting the national response to the COVID-19 experience. So that point there about how our teams, in our Baton Rouge region, they're a part of that. They're a part of us learning and helping to educate not just our systems, but people from around the country there. Such a great point. And Tammy, you're there every day in what you call the trenches of the ICU. I'm sure you have some stories about this from your experience there in the last few weeks.
Oh, absolutely. So many amazing stories from the patients that are dropped off at the ER because their family's not allowed to come in. We had a particular patient, daughter brought her in. She was immediately in respiratory distress. We had to intubate her, put her on the ventilator, bring her up to the ICU, and the whole time her daughter can't come in. We're having to communicate on the phone, let her know what's going on. And as the days progressed, she spoke to the nurses frequently and the providers, getting updates on her mom. And only for almost a week, she was on the breathing machine. We were able to get her off, extubate her, and the nurses decided to surprise her daughter and Skype her or FaceTime her, if you will. And when her mom's face came onto the camera and she saw her daughter and her daughter saw her, it was just pure raw emotion. And from the nurse to the family to the doctors, it was all tears. It was great. And we really have done that with a lot of our patients that so the family can see them, because as you can imagine, if your family member was up here unable to talk to you, especially in the ICU, most of them are on the ventilator, and just to have that connection that nurses are just talking to you on the phone, and then to be able to see your family, it's just been incredible. And just story after story of that communication, because these nurses are not just taking care of the patient, they're taking care of the family. And just so important that everybody works together as a team here, and it's just awesome.
Yeah, absolutely. I've actually heard that from some other leaders, closer to where I work, that the amount of care we assume, or the general public, those of us not in the clinical setting, we assume that you're caring for the patient, that makes sense. They're the ones admitted. But there's really a holistic approach to patient care. And it also means caring for their families, who, especially right now, feel particularly vulnerable, not being able to be present for them in their hours of greatest need. It's such a testament to the nurses and all of the staff who have really been serving as a sort of on-site family for these patients, which is totally in line with Ochsner's values of putting patients first. It's just such a unique way to think about a patients first mentality, whatever the patients need, even if it's for taking care of their families, right? Wow. Looking forward, which is what Ochsner loves to do, I think this might be a good one for Diane. What about after COVID? What's the future hold for Ochsner Baton Rouge?
Well, certainly we're looking forward. We have so much happening here. To Eric's point, we know that COVID is going to be with us for a long time, and we will continue to get smarter and better at providing that care as we learn more and more. We're continuing to grow our services here in Baton Rouge, and as it specifically impacts the ICU, we will be expanding our cardiovascular surgery program. We're adding a second neurosurgeon who I think starts Monday, so that's very exciting. And so that will allow us to expand our neurosurgical programs as well. So we really, really see a bright future for Ochsner's presence here in Baton Rouge, and we see huge opportunities for people who are interested in the ICU. I am an old ICU nurse myself, so it's really been a blessing and a privilege to watch this team stand up and perform in such an amazing way, and look forward to what they're going to do in the future.
And get into our team, some of my colleagues, Matthew, this opportunity presents so many long-term opportunities, not just in some COVID response capacity, but really to join this team, this family team that's been stepping up, being such incredible volunteers. What would it look like for someone interested in joining the Ochsner Baton Rouge team?
Well, thanks for the question. It really is a great group. I think you can see that through the executives in terms of, how they support their staff, making sure they have the resources to practice safely. But we also invest in our people. The organization is growing. We're financially strong, and that allows us to invest both in terms of the technology so that our clinicians have, cutting edge technology, but at the same time, to make the meaningful investments in terms of pay and benefits that do make a difference and are certainly important to support our staff who really are doing amazing work taking care of the sickest of the sick. So, our job on the TA side is we have to find those individuals who not only have the technical skills, but certainly share the values of the organization that puts our patients first. And it's certainly something that we take very seriously as well.
And I know that we've integrated some unique ways to have orientations and onboarding, be able to adjust to really, that social distancing we all need to continue maintaining, right? Can you speak a little to those?
Without a doubt. I mean, we've really been forced to embrace more of a virtual recruitment model. I know individuals on our team are reaching out to some of the local nursing and allied health schools to try to set up some virtual conferences where we can continue to engage with those patients, such as this. Obviously, allow us to get Ochsner's message out, in a safe way. And we want to be respectful of what we need to do amidst the pandemic. But we're actively hiring. We never stopped. As I said, we don't. A growing organization, lots of opportunity. I think Diane mentioned the ICU expansion. So we're always looking for individuals who share our mission, who are looking for a challenge. We offer a lot of support for those individuals who want to grow in their career, go back to school. And we also do professional development. We have a clinical ladder program. We have a bonus for those nurses who pursue national certification. So it's really important to us to provide the tools for those clinicians to advance in their career.
We put our patients first, and from the corporate side, those of us unable to put our patients directly first, we put our people first. We put our people first, whoever that is, so that those who have patients right in their front door, they can put patients first. And especially the Baton Rouge team, I mean, this is just the best example of teamwork that I've seen, when we put our people first, supporting them, providing them incredible benefits for professional development, like you mentioned, Matthew, the resources and adequate PPE and technology, they all take care of each other as well. So I think
that's the benefit of being a large organization, but also a nonprofit, is that we can invest our resources into our people. And it's certainly something that, the organization does, and we have a very generous merit program. And you mentioned benefits. We went to day one benefits, which is something that not a lot of organizations are doing. So,
right.
And we do yearly surveys of our employees to see what benefits are we offering, how can we improve them, because it really is important that we're taking care of those individuals who are working so hard to care for our patients.
Right, absolutely. And you said standing up day one benefits. I'm sure that is exciting for our students who may not have other benefits that they're on right now, who are eager to go ahead and start.
Absolutely. And that change was made in part due to surveys. It was something that was identified as a need, and we were excited to be able to offer that.
I had one other thought. I just mentioned students, and I thought, maybe Diane, do you have a message for any of those students out there who might be listening in now or when they watch this recording in the future?
Oh gosh, I would just say, everyone starts somewhere, and I have never worked for an organization after almost 33 years as a nurse that is more supportive of professional growth, helping people understand how to really take care of patients, how to learn how to do that very well. We have very strong orientation programs, and I would say that Ochsner excels at supporting particularly new grads in their journey toward becoming excellent nurses.
Yeah, absolutely. And I'm on the team of of the individuals within talent acquisition that support students. So hello to any of my students who are watching this video now. We really are so proud of what you've done. We're really so proud of the work these last few years, as well as how you've been so resilient to make it through a really important time in your life, probably the hardest semester of all of your schooling in the middle of COVID. I can't say enough, congratulations on your efforts. And I know Diane and everyone else here joins me in that.
Well, I wanted to touch on what Eric said, which I think is really important.
Yeah.
Ochsner as an organization, we're growing and we're stable and really is at its best when confronted with a crisis. So, I really just want to thank the work that, all the executives in Baton Rouge did and the teams that they lead. Really, really proud to be part of this organization and the work that they're doing.